Welcome everyone. Today I'm presenting an integrative review for my Master in Nursing Science titled Self-Efficacy, Medication Adherence and Quality of Life in HIV. Hi, I'm Vijaya Babu for the Master Student in Nursing Science. This presentation explores the vital psychological and behavioral factors that influence health outcomes for the people living with HIV. Here is a brief roadmap for our talk today. We will begin with the introduction of core concept, outline the study design and the Prisma flow diagram, and then delve into the study characteristic. Finally, we will break down the key findings, results, clinical implications, and conclude the future research priorities. Despite remarkable advancement in the antiretroviral therapy, HIV remains a significant global health challenge. In this review, we look at the three main pillars. The first is self-efficacy, which is a patient's confidence in managing their complex treatment regimen. Medication adherence representing the strict lifelong consistency required with the ART. And the last is quality of life, a multidimensional outcome encompassing a patient's physical, emotional, and social well-being. And ultimately, treatment self-efficacy drives the consistent medication adherence essential for the viral suppression and improved quality of life. To explore these variables, a rigorous research strategy was employed. We researched major databases included PubMed, Medline, Complete, Science Direct, and the CINEL. This search was restricted to English peer-reviewed literature published between the period of 20 to 2025. Key research terms included HIV, people living with medication adherence, self-efficacy, and quality of life. Following the Prisma framework, we begin with 76 initial records. After removing duplicates, 61 records were screened by title and abstract, leading to 49 full-text articles assessed for eligibility. The final review includes 26 high-quality studies. Studies were primarily excluded if were published before to year 2020, were not in English, were methodologically weak, or did not access the key variables. The 26 included studies offer a broad global representation, featuring research from 16 countries including Ethiopia, the United States, China, South Africa, and India. These studies design varied encompassing cross-sectional observational studies, systemic reviews, randomized control trials, and concept analysis. Sample size range widely from 80 to 4,867 participants. The research was primarily studied in hospital outpatient clinics, community health centers, and ART clinics. Our key findings highlights important demographic correlations. We found that younger adults show lower adherence, while older adults face multimorbidity challenges. Women often report poorer quality of life and adherence due to caregiving burden and intersecting stigmas. Furthermore, lower socioeconomic status and limited education are linked to the treatment interruptions. Importantly, self-efficacy act as a psychological engine. Higher self-efficacy is strongly associated with better adherence and acting as a mediator for psychological interventions like skill training. Conversely, low self-efficacy correlates with missed doses and depressive symptoms. Regarding outcomes, consistent adherence reduces symptom burden, enhancing physical functioning and overall quality of life, which in turn creates a bidirectional relationship and informs ongoing self-efficacy. This table summarizes the core relationship. The stronger There is a strong and consistent positive association between self-efficacy and adherence, as confidence drives behavioral action. This leads to a strong link between adherence and viral suppression. Subsequently, viral suppressions and improve quality of life. While social support moderately builds on self-efficacy, stigma acts as a negative moderator, undermining the protective effects of the social support. These findings present clear directive for clinical practice. This should implement routine psychosocial screening using validated instrument to monitor patient well-being, provides must deliver targeted adherence counseling that address unidentified vulnerabilities. We also need a integrate stigma reduction strategies directly into care pathway. Finally, care models should be feature nurse-led interventions combining skill training with psychosocial support, ensuring a holistic approach that address mental health, comorbidities, and social determinants. Future research priorities. Moving forward, research should be prioritized in longitudinal, multi-level design to track self-efficacy and adherence trajectories over time. We need specific investigations into resource constrained public hospital setting and use of the objective adherence measures, such as electronic monitoring and pharmacy refill proxies. Additionally, there is a critical need for this more research on intersectional stigma and the development of culturally validated quality of life instruments. To conclude, this integrative review demonstrates that self-efficacy and medication adherence are interconnected and critically determinant of quality of life for people living with HIV. Treatment self-efficacy serves a vital psychological buffer against social demographic and clinical stresses, directly driving the consistent medication adherence required for long-term virologic suppression. That's all from me. Thank you for your time.